Good afternoon, everybody. You guys know me, I'm Professor Reber. Welcome to class. So we have a big unit exam coming up, and one of the big topics on that exam is COPD, chronic obstructive pulmonary disease. And I know that one of the things students a lot of times struggle with is medications. So the purpose of today's class is to help you guys get strong on medications before our exam. So we're gonna flip the classroom a little bit today. I asked you guys to do some preparation before you came to class, and then we're gonna do some things to help you get ready for that exam. So let's start by looking at our goal for today. Our goal is to ensure the student nurse has strong knowledge of the medications commonly given to COPD patients for the purposes of test taking, but also for the purpose of providing high quality patient care. Okay, now next let's take a look at our objectives for the activities and what we're going to do in class today. At the end of today's lesson, the student will be able to use brainstorming to identify the most commonly given COPD medications and summarize their important points for administration. Number 2, apply knowledge of pharmacology and COPD pathophysiology to answer critical thinking questions. Number 3, use a puzzle activity to compare commonly administered medications for COPD patients and to categorize those medications into their functional classifications. Let's take a look at our resources. I asked you guys to prepare ahead of time for class, and I know that you read in your textbook. We're using the Pearson textbook, Nursing a Concept-Based Approach to Learning, 3rd edition. Our module is oxygenation. Our exemplar is COPD, and the pages are listed here. They're also linked for you in Canvas under the COPD module. For your medications, we're using the Saunders Nursing 2019 Drug Guide, but several of you have already started using the Lippincott app, which is the 2020 Drug Guide. Are we ready to do it? Thinking caps on. What medications do we most commonly administer to COPD patients in the hospital? What is it that we're giving them when we're caring for these patients?
We're giving them bronchodilators.
Bronchodilators for sure. That's a very important class of medications. What other meds?
We're also giving them inhalers.
Okay, inhalers, and usually those are bronchodilators, but there might be another medication in an inhaler. So what other types of meds are we given?
Steroids.
Steroids, definitely. Anything else?
Antibiotics.
Okay, antibiotics, that's an important one. We're frequently giving those. Can you think of any other kinds of medications? We've got bronchodilators, we've got steroids, we've got antibiotics. Those are some of the main ones I thought of too. Let's take a look at bronchodilators and see what I came up with. Aha, just about the same stuff you did and plus one more that we will also take a look at. So let's start with anticholinergics. What do we know about this classification of bronchodilators? Just the most important things.
I know that they relax muscles.
Yes,
and
sir.
that they prevent bronchospasm.
Good. So they are muscle relaxing drugs. That's how they dilate, and because of that, they're very good for preventing bronchospasm, which is a problem for COPDers. So I've got that one up there. And then we want to know at least one really popular anticholinergic bronchodilator. Do you guys know one?
I know Atrovent.
Atrovent, very good. So we want to know the generic and the trade name. Make sure you're familiar with those. Let's move on to another category. What does SABA stand for? A short-acting beta agonist. There's a very, very popular drug in this category that many, many people are on. Does anybody know what it is?
Albuterol.
Albuterol. Also known as salbutamol. Those are both generic names. And the trade name, Proventil or Ventolin. Very, very common because not just in COPD, but in asthma, especially, almost all rescue inhalers. All right, let's move on to the next one. How about LABAs? What does LABA stand for?
Long-acting beta agonist.
You got it. Okay, so what do we know about LABAs?
They have to be administered with a steroid.
Yes, that's very important. Does anybody know why we have to give them with a steroid? You can look at your notes, you can ask your neighbors. because they can trigger an event, very much like an asthma attack. And how about a commonly given medication that's in this class? Can you think of one? Take a look at your notes.
What about Advair?
Good, so that's a combo drug. And one that's just a LABA by itself would be salmeterol, which is Ceravent. And then that definitely is an important thing to know that you mentioned, that you must take it with a steroid. And there was one last drug that I thought of and you guys didn't mention, and that is theophylline. It's an old drug, but we still want to know about it. The reason we don't give it as much is because it's a pretty weak dilator compared to these other bronchodilators, and it does stimulate the respiratory rate. Now, all bronchodilators are pretty well known for stimulating the heart rate. They're all a little bit of a stimulant, but theophylline will stimulate the respiratory rate, and it doesn't dilate as well, so why would we ever give it? Well, somebody's going to come in acute distress, and they already had their rescue inhaler, and they already have their LABA, and they already have their anticholinergic, and they still are in distress. Here's one more thing we could try to give them. So it's just one more thing that's in our arsenal to try, so we will still see it sometimes on a patient. Okay, let's move on to our next category. It's going to be corticosteroids, which you guys mentioned at the beginning. So before we go to that slide, let me ask you, what are the different methods that we can administer steroids? How can we give it?
They can take it orally.
Orally,
They can inhale it.
inhaled, anything else?
They can get an injection.
Right, so it could be IV or injectable. All right, so let's take a look. Corticosteroids, inhaled. There's a couple I definitely want you to know. Fluticasone, which is Flovent, and beclomethasone, which is Qvar inhalers. So a lot of your clients are going to have these types of inhalers. Okay, oral steroids, the one that everybody is on for everything. Prednisolone, which is prednisone. And for injectable, probably most commonly methylprednisolone, which is Solu-Medrol. All the COPDers are taking these on a regular basis, either separately with their bronchodilators or probably in a combination inhaler. Then they're taking courses of prednisone over and over and over, and then we're saving these injectables for when they really get into acute distress. So they're on a lot of steroids a lot of the time to try to bring that inflammation down. We have to remember that steroids have a price that have to be paid. So what are some things that we really have to look out for patients that are on a lot of steroids all the time?
They could get infections.
Risk of infection is a very serious risk. Okay, what else?
They can have high blood sugar.
Yep, they tend to have high blood glucose. So immune suppression, definitely a problem. High blood glucose, and especially in the diabetic population, that can be a real problem. And then they get thin friable skins, they get a lot of skin tears. So there are all the side effects that we've learned about in other exemplars with patients that are on steroids also apply to COPD patients because they are frequently on steroids. And I just want to make sure you guys are aware of the combination inhalers. Probably the two most common are the Advair and Symbicort. And of course they are the LABA and the steroid. Okay, let's move on to our last slide. It has a couple of different medications. So first of all, we have oxygen, which we can consider a medication, certainly given that to COPDers. What would you say is a common amount of oxygen that might be ordered for your COPD patient?
I'd say 1 to 2 liters per nasal cannula.
Very good. So we've talked extensively about why they are on low flow oxygen. I know you guys know about that. Why do you think I put antibiotics as a commonly given medication for COPD?
Because they have a bunch of pneumonias.
Yep, they come in with recurrent pneumonias. Most exacerbations of COPD are pneumonias, and then we just talked about on steroids, they're at risk for infection. So they're on a lot of antibiotics. And then lastly, an important thing to know is about statins. What kind of drugs are statins? What are they for?
High cholesterol.
They're drugs for high cholesterol, but why are we giving them to COPD patients? Does anybody know? So it might seem like we're giving it for cholesterol, but really it's an off-label use for COPD patients. It's been found to help with their pulmonary hypertension, and it can reduce the signs and symptoms of COPD. So this is kind of a newer treatment, a newer type of drug to be used for COPD patients. So that's an important thing to know about, and I know that you studied that in your materials for class today. Okay, it's time to test your knowledge. So get your sticks ready, and we're going to do a couple of critical thinking questions. All right, thinking caps on. Get your sticks ready. You are caring for a patient who's in the hospital with exacerbation COPD. Although he was oriented and calm throughout the day, when you check on him now, you see him moving restlessly in the bed. He's touching his IV tubing. Oh no. When you speak to him, he seems annoyed and mildly confused. What step do you consider next? Is it A, request for this patient to have a sitter or move to an observation room? Is it B, administer an anti-anxiety medication? Is it C, call rapid response for assistance? Or is it D, check this patient's vital signs and oxygenation status? You have 5 seconds. 5, 4, 3, make a commitment. 2, 1. And Santa says it is D. So even though we're talking about medications today, I just want you guys to remember, when patients start to act confused, and they weren't confused before, let's think about oxygenation, infection, hypovolemia. Let's think about the other things it could be before we give medications. That's a really important foundational concept. All right, last question. Your COPD patient asked you about his new prescription for atorvastatin, which is Lipitor. He says he's pretty sure the doctor made a mistake because his friend takes this for high cholesterol, but he knows that his cholesterol is okay. What is the best response? Is it A, that you explain these types of medications for high cholesterol can be used to help reduce symptoms of COPD as well? Is it B, you tell them that's something that you'll need to speak to your doctor about? Or is it C, you explain that most people with COPD also have atherosclerosis, so this is a very wise precaution against heart disease? Which one do you think it is? A, B, or C? 5, 4, ooh, we got some strong opinions on this one. Let's see. Santa says it is A. Very good. All right, are you ready for the last activity of the day? All right, so let's take a look. We have a little puzzle. This is, I put together something that's all the information that we've studied about the drugs today. And they're kind of in these sentences, almost like mathematical formula. So take a good look at them. And then I've cut these words up into puzzles. And you each have a bag like this. It's got your puzzle pieces in it. So take one last good look. I'm gonna turn the lights on. I'm gonna turn this slide off, and then I'm gonna say go, and you guys are gonna race to put this puzzle together. Okay, so take a look at how it goes. Each puzzle piece includes the generic name, the trade name, the functional class, and then maybe one important tip, administration item, or something that's important to know about that drug, okay? Okay, so when I say get ready, get set, go, you guys are gonna dump out your puzzle pieces, and you're gonna try to put them in the order of the puzzle page that you saw on the screen, okay? And when you think you have it, raise your hand. I'm gonna walk around and just give you assistance. Get ready, get set, go. I think we almost got it.
Done.
Good job. All right, that is it, class. Thank you so much, and I will see you guys on Friday for your exam.